Associate Professor Margie Danchin is a consultant paediatrician at the Royal Children's Hospital and a researcher at the Murdoch Children's Research Institute. She focuses on many different areas, and one of them is the impacts of COVID on children's wellbeing. Margie, welcome back.
Good morning, Hilary. Thanks for having me.
Well, it's really good to be able to draw on your expertise this morning, because we are seeing news reports of large increases in flu cases, up to 500% at the Children's Hospital in Melbourne. From your observation, how widespread are COVID and other infectious diseases in schools around the country at the moment?
Yeah, look, it really is a difficult time for kids, trying to get back into the classroom, and now many of them needing to go home for viruses, as you say, not just COVID, but mostly influenza at the moment. And, we really did anticipate this resurgence of flu, but it has come earlier. We expect flu to sort of peak in, June to September, but here we are in May. And as you said, we've already seen, it's actually a 700% increase in cases in the last month. At the children's alone, I think we've seen over 120 cases compared to about 16 cases in March.
Wow. Well, and as you said, there are other viruses. Can you give us a list of them and tell us roughly how severe they are at the moment?
Yeah, so we obviously are seeing a lot of influenza, as I said, but other viruses, common cold viruses like rhinovirus, para-influenza virus, and also the group called enterovirus, which are those more gastro-related viruses. They're all sort of unfortunately coming back now. And I think it's all really related to what we saw with the suppression of viruses with all of the public health measures with COVID over the last couple of years. Now, with everything being relaxed and international borders opening, we've just seen this resurgence of viruses. And as you say, it's not just flu, but many of the common viruses that kids normally experience.
And the WA Chief Health Officer recently said most of the COVID spread is happening in social situations and family gatherings, not at schools. What are your thoughts on that?
Yeah, well, flu in particular is mainly spread through kind of large particle droplets, so sneezing and coughing. We're all familiar with COVID being quite airborne, as well as, sort of droplet spread in particular. So, yes, it's true. Flu and many of the common respiratory viruses do occur in sort of more enclosed spaces, and we do see that spread more in households, aged care facilities, childcare centres, but of course in schools as well, because we know for flu in particular, kids are infectious for about 24 hours before they develop symptoms, and then for a good week after they get sick. So, of course, schools are ripe for spread of these viruses as well.
We're speaking with Margie Danchin, Associate Professor Margie Danchin, a consultant paediatrician at the Royal Children's Hospital. And I'd be keen to hear from you too, wherever you are around Australia, about how this surge in various kinds of illnesses is affecting your school community. You're seeing changes. Our Facebook page says, yep, sports days cancelled, parent-teacher interviews going online, all kinds of effects. Send us a text 0418 226 576. Margie, the NCIRS, the National Centre for Immunisation Research and Surveillance, did a study late last year of COVID spread in schools, and that suggested that COVID spread didn't dramatically increase, with their words, despite the Omicron variant and a sharp rise in school exposure events. Should we feel reassured by that?
What we've seen consistently with the spread of COVID in schools is that it pretty much reflects community transmission. So if there's a lot of COVID in the community, in households, then we see that reflected in schools. We did see a spike in February when schools returned this year with Omicron, where there were more cases perhaps than we would expect in the school environment, but that actually settled and came down and then again reflected more community spread. So that NCRS study that you're referring to did clearly show that, and it actually showed that more of the transmission occurred between teachers, so staff member to staff member, or staff member to student, rather than between students. So that's also important to note. So I think, schools are not necessarily at higher risk when you're looking at households as well.
Let's have a quick look at one of our great bulwarks against these infectious diseases, vaccination rates. We'll whip through some of the different types. How vaccinated are children against COVID at the moment?
Yeah, so probably one-dose vaccination coverage in kids is getting up to 60%, and 2 doses is around about 45%. And of course, we'd really like to see it higher than that. We're strongly encouraging, all primary school age children to have 2 doses of COVID vaccine 8 weeks apart. Even if they have experienced COVID infection, where ATAGI are now recommending that they wait 3 months after infection before getting their second dose if they do that. And we really believe that COVID infection, has in some ways prevented parents from going and getting their kids vaccinated if they feel they've already experienced, the illness. So it is an issue, but the coverage rates are much higher in the adolescent kids. So the over 12s, much higher. We're looking at well over 85, 90% 2 doses in that age group.
We're getting a sense of the disruption that's happening on our text line, 0418 226 576. Every time a child is unwell, there's a parent or grandparent who has to stay home to mind them. Let's take more care to prevent this, says one person. And another says, just this morning I'm juggling children's colds with having just come out of COVID isolation. So as you say, Margie, there's a lot going on for a lot of households. And they say this year so far for us is quite disjointed. They say, I feel people aren't so on top of hygiene as they were, despite travel being free. Margie, let's just have a quick, unless there's something you'd like to add to that, I do want to look at the other vaccination rates.
I was just going to simply say it is really tough. It's tough for families. It's also really tough for teachers. There's huge staff shortages now across many schools, and most of them actually more away due to flu than COVID at the moment. So schools are struggling and trying to work out how to manage that. Some schools are sending whole year levels home, alternating different year levels for different days, merging classes. It's really tough for schools. It's tough for families. And so that's why I just really want to plead parents that this is the year they need to go and get their kids the flu vaccine. If they're over 6 months of age, they need to go and get the flu vaccine now.
Well, yeah, let's look at the flu vaccination rates for different ages of kids. How are they looking at the moment?
It's hard to accurately know at the moment what proportion of children are vaccinated. We know that it's been very low in the last couple of years, incredibly low last year, and that's part of the problem, that we've got this sort of immunity deficit, if you like, where, many children have just not experienced viruses for 2 years, and kids under the age of 2 have seen almost no viruses, of course, and then they've had, very low flu vaccine coverage. So, look, I would say the rates would be somewhere between 5%, 10% of kids have had a vaccine. Very few. That might even be optimistic. So, we just really want to encourage that people can take their child to the GP. If they're over the age of 10, they can go to a chemist, to a pharmacist and drop in. But, personally, I actually got my teenage girls all vaccinated on Sunday, and I had to ring around 8 different chemists to find a pharmacy that was open that could vaccinate them. So, people are telling us that they're finding it hard to also access the vaccine. So I just encourage people to keep going, keep trying and get their kids vaccinated.
Well, do they need to be free too? I mean, mine cost $40 and then I had to get a $20 one for one of my children. I mean, that's a lot if you've got a bigger family.
That's right. So the vaccine is free for children 6 months to 5 years. And of course for higher risk groups, so, all Indigenous people over the age of 6 months, kids with chronic medical conditions over 6 months, it's free. People over the age of 65, it's free, and pregnant women. So they're the groups that can access it for free. But as you said, for most people, it's about $25. And also just want to highlight there's another vaccine this year. It's called a cell-based vaccine, which is a little bit more expensive. It's about $50 a dose. That's incredibly effective. That's available for children over the age of 2. It's called Flucelvax, and that's another option if the more traditional vaccines are actually stocked out in chemists or by GPs. If parents are able to pay a little bit more, they can get the Flucelvax cell-based vaccine for their children, which was the option I had to take on Sunday. I had to pay a little bit more to get the girls done because they had actually run out of the NIP vaccines.
Well, Queensland's making it free for everyone because they've got this, 1 week doubling of cases. Do you think that should be more widespread?
I do. I think that's excellent. I think if the vaccine was available for free for everybody, it would be fantastic and really encourage people to get out there and just get the vaccine.
What about booster shots for teachers, Margie Danchin? Do you think that that might help slow the spread in schools?
Boosters for COVID.
Yes, sorry, for COVID. We're switching from flu to COVID.
Yes, absolutely. I mean, we know that the booster dose coverage at the moment is around about 60%, maybe a little higher in some areas, so there's still a way to go. And the booster dose for COVID is absolutely critical. If you look at the immune protection, even 2 to 3 months after the second dose, it's really dropped against infection and against the prevention of people getting severe disease and going to hospital. So if people listening have not had their booster dose, and especially teachers, they need to go and get their booster dose if it's 3 months after their second dose of COVID vaccine.
Strong agreement with you, Margie Danchin, on the text line. Teachers need to be getting their 4th dose now. They're front line. Older teachers at my son's school, especially, says this person, who teach VCE, are front line. Also, a side question from this person, will VCE HSC take account of COVID this year? Very good question. Can't answer it. Good idea, though, for future stories for us. Margie, just quickly back to flu vaccinations. What about for newborns? I mean, you can't vaccinate kids under 5. How do you protect your newborn?
Excellent question, Hilary. Yes, it's really important that people realise that flu vaccination is only available for infants from the age of 6 months. So to protect newborns and littlies, pregnant women need to get the flu vaccine in pregnancy. It's 2-for-1 protection. It protects the pregnant mum who is at higher risk of severe flu disease and, sort of double the risk of needing to go to hospital with flu or going to the intensive care unit. So protects mum, but also protects the baby in the first 6 months of life, because the antibodies that the mum produces can actually cross the placenta to the baby and protect the newborn. So really important that pregnant women get the flu vaccine at any time in pregnancy from now if they haven't had it.
We're speaking with Margie Danchin. She's an associate professor, a consultant paediatrician at the Royal Children's Hospital and a researcher at the Murdoch Children's Research Institute. And we'll move on in a moment to talk about what are the ways forward, what are the best ways to approach this situation where we've got, as you said, a 700% increase in the flu among children in some cases in the Royal Children's in Melbourne, and COVID's still bubbling away quite heavily in our communities, and other viruses as well, rhinovirus, gastro, lots of things. But a quick question for you, Margie, from text. My daughter has just recovered from COVID. She's 9 years old. How long should I wait for the flu vaccine?
Great question. As soon as she's well, and kids are recovering pretty quickly, she's eligible, to get the flu vaccine. And in fact, for well kids, you can have the flu vaccine and the COVID vaccine at the same time. If the child's had COVID but they've recovered, go and get the flu vaccine. And even if they've got a little cough, a little lingering cough, that's okay. They can go and get their flu vaccine.
Now, Tasmania still mandates masks for secondary school students and for teachers, but most other states and territories don't. South Australia is hoping to drop their last mandate today. Is this the right approach, relaxing those mask restrictions in schools?
Yeah, look, I don't think that we can issue or continue with mask mandates, and James Merlino has said the same.
The Victorian Education Minister.
Yes, absolutely. Sorry, Minister Merlino. But I think, we can encourage masks, and parents can feel free to encourage their children to wear masks at school if they would like to. But it actually just comes back to the most important thing is if kids are sick, they should not be going to school. They need to stay home because that's how we obviously spread the virus, by droplets. But simple things like, blowing your nose and sneezing and coughing into your elbow and washing hands, all of those things that I think we were probably doing a bit better in 2020 and 2021 when COVID was really a big issue, and it is still a big issue. But I think many people have relaxed these sort of basic hygiene measures, and they're important. I don't think we need to rush back to mask mandates. But of course, in enclosed areas, I think people can be sensible and use them. Public transport, we're certainly still wearing them in the hospital, on, planes. So people are still wearing masks.
What about the close contact rules, Margie? Because siblings of positive kids can now go to school. Is that a good idea?
I think that is fine. I think siblings of positive kids can go to school. Again, important that they are face-to-face learning and that we're sort of managing risk. And I think as long as they're tested and they're negative, then they can go to school.
And the rapid testing protocols that are in place for schools now, I think the schools are still giving out RATs, at least until the end of this term in the places I'm aware of. Are they effective in reducing transmission of COVID, the protocols that we have in place now?
Well, the surveillance that we did have in place, from the start of term one, which was twice weekly testing for kids in mainstream schools, and then, daily testing for kids in special schools was incredibly effective, in terms of identifying asymptomatic COVID cases and then being able to keep those kids at home and also quarantine family members. Now, as you say, it's recommended, but not sort of mandated, if you like, that everybody test as frequently. I think people now are really aware. They are testing kids if they're symptomatic. They are keeping them home. And I think it has to be monitored very closely. I think more the test to stay strategy is appropriate now. If, there's a symptomatic child, stay home. Other class members make sure they test, especially if they were close to that child. If they're negative, go to school.
Some interesting views coming through on the text line, 0418 226 576. James says, we need to get on with life. Viruses are a part of that. If you're sick, stay at home. And if you're well, live your life. And Kate says, thank goodness there's been a change to the mindset where it's not cool to send kids to school sick now. Sharing it helps nobody. And the perspective from regional schools is really interesting. Margie Christine says, my daughter teaches in a small regional school. When her own children get sick, it's difficult for her to stay home to look after them. If she takes leave, it's almost impossible for the school where she teaches to hire a casual teacher. What is the effect of all this change and uncertainty and disruption on children in schools?
Well, I think that's an excellent question. And of course, it's accumulative, particularly for Victorian kids, after the last 2 years and such extended periods of home learning from lockdowns. It's really hard for them to still be experiencing all this disruption. And I honestly take my hat off to teachers. I think they are extraordinary. There are many, as you say, who are remote teaching classes if they are unwell or if they are looking after unwell children to try and keep things moving. So it is very challenging, and this disruption is continuing, and everyone's just trying to do their best. And I think this is going to continue through the winter period, unfortunately, probably for the next 4, 5, 6 months.
On masks, there's some interesting variety of views as well. One person says, last week at Richmond Station, a very big station in Melbourne, a hub station, a huge number of secondary school students and their teachers got on the train and filled the carriage, not a mask in sight. Given it's still compulsory to wear them on public transport in Victoria, good luck getting them back in the classroom. Very selfish behaviour given the infection rates in the community, says this person. There are tens of thousands of cases in Victoria daily lately. And then this person says, so unnatural for kids to never see their teachers' faces, not conducive to learning. It's so important that teachers and kids can properly engage. I wish Tassie would end the high school mask mandate. It's been too long. So there's still, there's a lot of diversity of view in the community. Margie, what about the idea of returning to remote learning, just in our last minute or so together? If there are a lot of cases at a particular school, is that a good balance when it comes to the effects on children's wellbeing compared to the risk of catching COVID or flu?
No, I think returning to remote learning and home learning is an absolute last resort. I think we're still only starting to understand the impact on kids' mental health and well-being, their social development. I think it is so damaging for kids to be at home for extended periods. We need to be looking at every other strategy. I would be looking more at masks in schools again before I would be looking at returning to home-based learning for children. I think it's incredibly damaging. And we're seeing at the moment so much anxiety, depression, school refusal for some kids struggling socially to get back to schools. This is me as a paediatrician speaking and as a mum. So I think not. I think we really need to manage these viruses. And the most important thing I would say is if kids are sick, they need to stay home. That's probably the thing that will make the biggest difference at the moment. Yeah,
I do hope that's a lasting culture change coming out of these pandemic years. Margie Danchin, thank you so much for your time today on Life Matters.
Thanks for having me.
Associate Professor Margie Danchin, consultant paediatrician at the Royal Children's Hospital and researcher at the Murdoch Children's Research Institute.